Okay, everyone. So as chairperson of Jefferson County Health Department Board of Trustees, calling this special meeting to order. This is a special meeting of the board. We're holding it because we've had requests to hold our meeting in a larger venue, to hold a meeting after business hours, and to allow public comment, which we've already done twice before. So this is the third time that we're allowing citizens to make comments. So this meeting is being streamed online, as our previous meetings have also been. I want to thank the folks. We've had large numbers of people viewing our meetings online. We appreciate their interest. We've also obviously gotten lots of emails from folks from all over the county. And I want to assure everyone that those have all been received and viewed by the board members. So the meeting is called to order. Can we have a roll call, please?
Mr. Deal?
Here.
Dr. Henry?
Here.
Mr. Prater?
Here.
Mr. Pig?
Here.
Ms. Davis?
Here.
I'm going to ask Dr. Henry, our board member, to read Jefferson County Health Center mission and vision.
The mission, JCHD will champion positive health outcomes and behaviors through innovative programs and community engagement. And the vision is enhancing the health and safety of Jefferson County.
Okay, our next item on the agenda is approval of the agenda.
I'd like to make a motion to modify the agenda, move item 7 for old business, approval of the minutes of the December 24th, 2020 meeting to the spot above the director's report, and also strike item 8, new business, as there is no new business.
I second that motion.
Okay, so we have a motion and a second to amend the agenda. Any discussion? Hearing none, all in favor of the amended agenda, please say aye.
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 Anyone opposed? Okay, that motion passes. And so, due to the amendment, the next item would be old business, which is approval of the minutes from our September 24th, 2020 meeting. I have a motion to approve those minutes.
Motion to approve the September 24th minutes.
Second.
Okay, I have a motion and a second to approve those minutes. Any discussion? Hearing none. All in favor of approving the September 24th meeting minutes, please say aye.
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 Anyone opposed? Okay, those minutes are approved. All right, our next item is our director's report. Which is going to be a review of our community meeting that was held last week.
So there are 3 things that I'm going to discuss tonight. The first being looking at our current restrictions and mandates. And so I think there's a lot of confusion within the community about what still exists and what is no longer in place, or what applies to individual things such as our individual entities, such as long-term care facilities or schools. So that will be the first thing. The next thing, we'll talk just a little bit about some of our baseline data of where we're at. And then the last thing that I will discuss will be talking to you about the recommendations that were made by our stakeholder leaders. We met with a group of about 40 stakeholder leaders in the community in the last week. was a very productive conversation, and we've came up with some very positive ideas of how we can move forward as a community. So I will inform you of the issues that came up that they identified, as well as the strategies that they have presented. So the first thing I wanted to just address is that there are currently no restrictions or mandates in place from county government. So the last order that was executed was on June 12th. It was Executive Order 20-030-0.8 and Health Director Order 20-06-12-01. That was the order that opened the county and superseded all previous state home orders and restaurant orders, as well as encouraged mitigation measures, personal protection, basically trying to protect our vulnerable populations. But as of June 12th, there are no more health department or county mandated restrictions within the community. The only order that is still standing with that is the emergency order that was implemented back in the beginning of March, and that allows the county to incorporate and utilize the emergency powers to be able to ensure that the county stays safe and be able to utilize funds for the protection and rebuilding of the community due to the pandemic. One of the things that we have received questions about a lot are long-term care facilities. The health department does not mandate or have guidelines for the long-term care facilities. The only time that a long-term care facility would receive a mandate from the health department or an order would be if there was an outbreak and a significant outbreak. And then at that point in time, they would receive a voluntary order, which would give them guidelines in terms of how to help protect their clients, what resources they can utilize, and it would set them up to work with one of our internal teams of nurses that will work with them on a daily basis to help keep track of their patients and to really help facilitate the process of getting the illness eliminated within the four walls of the long-term care facility so that they're able to regain and continue moving forward. There are, however, two guidelines or two groups that do have guidance over long-term care facilities. One of them is the Missouri Department of Health and Senior Services. So for those who don't quite know, local public health is separate from Missouri Department of Health and Senior Services. Though we both have Department of Health, we are separate units. The Department of Health and Senior Services at the state level provides guidelines, but not mandates. So again, it's they are not providing restrictions, but they have given two things, which I wanted to point out. Missouri Department of Health and Senior Services has provided reopening guidelines, providing detailed information for nursing homes on visitation, dining, group activities, screening for patients and for staff, PPE, which is personal protective equipment, testing, and cohorting. So what that is looking at is trying to keep those who are sick separated from those who are not sick and ensure that they are able to basically let people go through the disease process and then be able to move them back with the healthy folks. So it's really helping to stop that spread. The phase, basically the state also lays out phase 1 and phase 2 activities. So phase 2 is talking about additional activities. So looking at visitation guidelines, dining options, which is really starting to open up those facilities to more interaction and what's happening in the community, which has not been able to be taking place up to this point. The most recent guidelines, which are from September, allow for facilities to establish essential caregiver programs. So beyond just looking at that end of life care and having those kinds of visitations, it's looking at what are some other things that individuals are needing within those long-term care facilities and what are the ways to start bringing those back in, as well as looking at indoor and outdoor visitation and how to meet safety practices. So that way they can move forward as well with starting to reincorporate visitations with families. The other agency that has guidance over the long-term care facilities and skilled facilities is the CMS. So, and I just lost it. CMS guidelines have guidelines and requirements. Center for Medicaid Services, I'm so sorry. It's been a long couple weeks. So with the CMS guidelines, they do have some requirements that are requested by the facility or facilities. One of the CMS memos in August described how they should perform testing and infection control processes for their patients and residents. So that routine testing that you guys are hearing about, where they have to either do tests every week or they have to do all of that, that's from CMS. That's their guidelines. CMS also put out a memo in September, which described how the long-term care facilities could establish visitation processes. So for both indoor and outdoor, and provides guidance for when and how that can happen. In the memo, CMS utilizes the county positivity rate as information to help guide that level of indoor visitation that should be considered. So again, helping you guys to helping the community to understand how what restrictions there are. A lot of times, though, the restrictions and the guidelines fall along the same lines of things that we are definitely promoting as prevention and mitigation measures. They're actually part of the licensing and restrictions that are upon these particular agencies from their accrediting bodies. As far as some facilities are under the Missouri Department of Mental Health, but at this point in time, we have not received additional guidance on that. So we just tend to give them that same information, but they're in terms of recommendation. As far as our schools, which I think are our second most discussed topic, again, JCHD provides recommendations based on color status, but we do not provide mandates. So we have not mandated the schools to require masks. We haven't mandated that they provide social distancing. What we have done is we have looked at each of the status indicators and the level of spread within the community. And we have provided recommendations to the school boards, but the school boards actually have the final authority to be able to implement those district-specific guidelines. Schools do fall under the Missouri Department of Elementary and Secondary Education and Missouri State High School Activities Association guidelines, which is MSHA, for their activities and sports. So again, there are certain guidelines that because they, DESE and MSHA have put into place. So MSHA actually goes a step beyond what our quarantine is for individuals and activities and sports. They actually ask them to stay out longer than what we're asking as our regular quarantine. So that's just an example of ways that there are some differences in those recommendations. And finally, the one requirement that schools do have to follow is out of the state underneath the governor's order. The Missouri Department of Health and Services, Senior Services has an order for the immediate initiation of contact tracing for school children. So for those children who are aged 3 to 19, they want those investigations initiated within 24 hours of getting a positive result and being notified by the health department. So those are just some guidelines in terms of what we are working actively with the schools, with long-term care facilities, with several of our local businesses to try to help them interpret. A lot of that, it comes down to, you may get several different guidelines coming at the same time from several different, you may get CMS and Department of Health and Senior Services and something else, and they go, which one do we follow? That's our role. So it's trying to help them to really figure out what those guidelines are and help negotiate back to those regulating agencies and say, hey, you're creating conflict because you're telling them to do two different things. How can we get this resolved? That's our role. So as we go into numbers tonight, I don't want to focus on the data. Tonight is not going to be about throwing a whole bunch of numbers at you and really setting the stage that way. It's more so to give you a baseline and an information on some of the data related to our mitigation measures and prevention measures that are common to COVID. So looking at social distancing and avoiding crowds, the washing hands and hygiene, as well as utilization of masks when social distancing is not available or not able to be done. So when we look at things like social distancing and avoiding crowds, we're getting ready to go into the holiday season. So it's something we definitely want to make sure that we're keeping our eyes on. We saw our highest numbers result from the Labor Day holiday. With 2 weeks after Labor Day, we had our highest weekly case count. So basically that's the incubation period, 14 days after it. The weekly case count increased 27% the week following Labor Day. And our 0 to 19 age group saw a 50% increase in weekly cases during that time period. So definitely see correlations related to holidays and times where people are going to be coming together. But then again, we've seen an overall decrease since that time in cases, which can be attributed to a lot of things. I think part of them is looking at, there's been a slight decrease in testing, but we're also seeing, there hasn't been any major holidays. There's no major events. The backyard barbecues are starting to come to an end. You're starting to see those scenarios where people who are comfortable around each other are not necessarily gathering in large groups. The reason that's important is because I think people tend to think about the 6-foot distance and the masks and those kinds of things when you're around people you don't know, when you're at work, when you're, in public and you're in a store. But when you're in the backyard and you're talking with your friends and your family members, it gets to be something where people tend to be a little less stringent with their activities. So that's one of the things that we think is kind of playing into that. But it's also very encouraging that we've seen a decrease of our 0 to 19 age group since Labor Day. One of the things that I would love to be able to highlight is that our schools have voluntarily put into place some very strong mitigation measures. They have put into place the, so the social distancing. They've looked at hybrid models in order to keep their class sizes down. They have included masks when social distancing is not available, and they have definitely really increased and looked at how they can incorporate hygiene, washing hands, and then looking at major disinfection in the time periods when kiddos aren't in school. So up to the point of including some are disinfecting desks in between classes. What we've seen is we're not seeing the cases we anticipated to see. Versus what we're seeing in the schools is when we're looking at the cases we're seeing a lot of times, it is external events or external sources where the children are getting sick and then bringing it into the school environment. So a lot of times it deals with family units where somebody is sick and then the rest of the family gets sick, or a situation where it might be somebody who works at a particular facility. I was really shocked at how many of our high schoolers work in long-term care facilities as assistants, which I think is awesome. But it also is an interesting thing that I never really thought about for a source of exposure. So looking at those types of things, we're really trying to work with our superintendents to figure out how can we celebrate that success of their mitigation measures, but as well be able to kind of help loosen and look at ways to better make sure that our students' whole needs are being taken care of, the mental health needs, the behavioral health needs, their education needs, and being able to do those kinds of things. The next piece is looking at washing hands, hygiene, and disinfection. So looking at, we're getting ready to go into the flu season. And last week was our first week of flu. And the flu, we need to account to make sure that we're looking at things for like the hospitalizations that are going to occur because of influenza. The combined effect from COVID and influenza is what we're concerned about, stressing the hospitals, because we generally tend to see flu cases and hospitalizations increase steadily until the end of the calendar year. And then really begin picking up around the beginning of the new year. So this is going to be our first year where we're going to have a full flu season and we're going to have COVID. So we're not quite sure at this point what to expect with that. But the one thing, again, that really falls back into this is those mitigation measures, washing your hands, disinfection, mask. It's a flu is a respiratory illness, just like COVID. So measures that we're taking to reduce COVID have a impact on flu as well. And we may see those numbers come down. Looking at test positivity and masks, one of the things, this is not about, I'm throwing this out here first. It's not mask mandate that I'm talking about. It's just showing the impact of having masks in place. In St. Louis County, the average positivity rate for the past week was 4.8%, which was taken directly from their dashboard. St. Charles County, where there isn't an order, but they are encouraging masks, their average positivity rate was 11.29%. Ours was about 9.3. So you can definitely see there is a difference, and it's not the only thing. It's not the only fail-safe strategy. So that's not what we're saying is what we need to absolutely the single thing we do. But it's a part of that. If you've seen the example of the Swiss cheese picture where it's, you've got social distancing, and then you've got washing hands, and you've got, wearing a mask. Each of those is protecting an additional layer. So with each of those layers that you add, you're adding an additional layer of protection. The last thing that I'll talk about as far as our numbers are, I know that a lot of times you'll ask about our hospitalizations. So I did ask Sarah to get me some information today. As far as, again, BJC and Mercy are the ones that we have access to at this point in time. We don't have the SSM data. So this is 2 of 3 major hospital systems within our area. Right now, we currently, as of yesterday, have 20 individuals from Jefferson County currently in the hospital. 6 of those are in an ICU and 2 are requiring a ventilator. So hospitalizations follow a similar trend to cases. So as we see our cases go up, our hospitalizations go up. As we see our not case numbers go down, they also go down. So our highest single day in admissions was on 9/22 with 11 admissions for Jefferson County residents. And that was also during the time that we were going through a red period as far as our case counts. As far as the color goes, I'm excited that we are coming back down. I think part of that has to do with people have seen, like we got to red, that's a little scary. We don't want to be there. We want to figure out how do we start getting back down and suppressing those numbers a bit. We're still in the orange, but this past week, we definitely saw another decrease in our numbers. But we have to be very careful in terms of looking at that 7-day rolling average because on 10/10, which was the end of the previous week where we were reporting numbers, the 7-day rolling average was 44.57 cases per day. As of yesterday, it's 51 cases per day. So it's going back up, but we're still in the orange. We're still good. So what does that mean? Why is it important to have this data in front of us? It's important because it's a baseline, nothing more. It's not meant to scare you. It's not meant to do anything but say, we can make a difference as a community. We're seeing it. We're seeing the numbers come down. We're seeing the impact of when people come together and start working together to do things. What we went into our community meeting last week, we had participants from behavioral health, from the school districts, from Mr. Executive Gannon. I'm sorry, I'm trying to go through these quickly. Mary Elizabeth, Representative Coleman, Eric Ammons from the hospital, Sheriff Marshak, our respective chamber organizations. We had pastors from our biggest churches within the county, looking at Judge Missy, as well as some of our city police and elected officials. And I think the discussion was fantastic because the goal wasn't about it wasn't about figuring out what people can't do. It's figuring about what people can do to be part of a solution. So looking at this in terms of, yes, the pandemic is global. It's impacting much more than us. But the reality is the solution is going to come from locals. We're going to figure out on our own what works best for our community. And that's how we're going to make a dent in these numbers. And so looking at some of those, that information, again, my first words to that group was, I made the promise, I will not ask you for a mask mandate. I'm not going to ask for a mask mandate. I want to put an olive branch out and find a way for our community to come together and work to find positive solutions to this. What that means is we're going to have to look at that board, that brainstorming board, and start throwing our ideas at it. How can we, as leaders, as citizens, as a health department, how do you pull that together into something that is going to meet the emerging needs that have come out of COVID? There is not one sector of our society that has not been impacted by COVID, whether that is business, whether that's long-term care, whether that is faith communities and kids. Everybody has been touched by this illness. And so everybody can play a part in our solution to this. When we looked at some of the kinds of things that came out of that, it was looking at things like acting proactively, not reactively, helping to really look at what kinds of messages would be helpful for people and how do we meet needs. So I want to share some of the needs that were expressed by those community leaders. The community leaders talked about a lot of things that kind of really were broad range as far as across the different sectors, but the increased number of cases. So looking at in our medical community was really worried about increased cases and that their staff is getting community acquired COVID rather than they're doing everything they can internally. And I think we're seeing that with long-term care facilities. We're seeing that with schools. We're seeing, folks are trying to do everything they can to keep it out, but it's what's happening in the community that's impacting their ability to be able to do their job. So there had concerns about the staff getting community acquired COVID, and then the age ranges of patients getting younger, where the majority of patients they're seeing, they said, is still over the age of 60, but in the last couple of weeks, the hospitalizations they're looking at folks in their 20s. So it's definitely starting to see a different age demographic. Across the board, again, with behavioral health, so there's an increased need for mental health services, whether it's individuals who had these needs prior to, or if it's a result of all of the changes. There's a lot of anxiety and a lot of depression in terms of the isolation of this illness, that it has just been necessary as part of the changes up to this point in time. So how do we work with individuals to meet the needs of mental health needs of people where they're at, as well as the increase in substance abuse services? One of the things Jackie, who's in charge of a couple of our programs at the health department that deals with suicide prevention and with looking at drug prevention, that is huge on her plate right now because she sees the need. We need to figure out a way to fill that need. And in order to be able to make a difference and to be able to slow the spread of COVID, we have to find ways to meet the whole needs of individuals. Our government representatives looked at lack of access to ancillary services. So things that have looked at there's two sides to that. People being scared to go to the doctor, but then doctors who've cut off access so that people can't necessarily get in to see their doctors like they used to. And the importance of reassuring and making sure that those primary services, the screenings, the follow-up visits are being taken care of so that people have access to that before it turns into a much bigger issue for them health-wise. Looking at the information overload, so trying to distinguish between CDC guidelines, state guidelines, health department guidelines, school guidelines. There's so much information out there right now that it is difficult even for us to be able to sort through, to try. Unfortunately, I wish it was a well-oiled machine, and I wish that everything pushed down from the feds and we followed the same model. But unfortunately, what's happening is that a lot of the information has been pushed and it's like to the next level. What we're trying to do is our best to help interpret that information for people. But I know, and I apologize, that it can be overwhelming at times. But just trying to make sure that we are consistent and that people feel like they have a good, reliable data source for their information. The schools, we're talking about, again, the community illness into the schools. They're very concerned about their kiddos, and so am I, in terms of the new learning formats. Traditional in-person, they're doing better than those guys who are doing all virtual. Those who are doing the hybrids, where it's virtual and traditional, faring better than all. So, I mean, it's trying to look at that and figure out how we can work with the schools to be able to find safe ways to get those kiddos back in and have a safe learning environment for them, as well as to ensure they're getting their needs met. Faith communities, we're looking at the stress on their parishioners, not only about not being able to see their loved ones in long-term care facilities, but then again, some of them with looking at the concerns of not being able to have church services or not the traditional church services that they had. That's a social point. It's a gathering point for especially our older population. And so ensuring that the faith community still has those touch points with their individuals and pulling that together. Finally, just kind of, we had talked about long-term care, the extra burden of those weekly tests from CMS. So we're working with them to try to look at, how do we advocate on their behalf to try to work to reduce that and to be able to look at ways that we can accomplish the same things without such a heavy stress burden on the staff, as well as work sites looking at business startups and being afraid to start new businesses and looking at staff morale as they're trying to figure out how to engage with this new system and new way of doing things. So those were the needs that were very poignantly put to the table as far as these are all impacts of COVID. How do we deal with this? How can we meet these needs as a community and as a health department and work to make sure our members have access? A lot of the recommendations came down again, and I will say of those 40 leaders, a common theme was we don't want to put a mandate into place. We trust our community to be able to take these steps forward, but we're going to have to find a way to do it together. With that, they want to work with us. We're going to be looking at, one, identifying what those resources are and helping to bridge those gaps as far as the needs, mental health, behavioral health, looking at how we can work with our long-term care partners in terms of those their visitations and working to ensure they have what they need as far as prevention. But then as well, looking at doing a community campaign as far as how do people connect to these services. So helping people acknowledge and understand that the stress that they're feeling is a normal thing that happens. Everybody is feeling some of this stress and everybody has been touched and impacted by this problem. So how do we come together to help normalize that for them and help them to be able to access those services and get them the help that they need? But again, just looking at ways to highlight the positives as well as to be able to look at our schools and our businesses were brought up as great examples of how we've worked together and they've been able to prevent the illness. And I think it's a good example for our community, the types of things that we could do if we all come together on this. So I'm not going to go too much further into this, but I think the most important thing for us at this point in time is we have to find a bridge. We have to find a way to come back together as a community and say, these are the steps that we need to take to do this. This is the information we need to hear. This is the way that we are willing to move forward. And this is how we can work together for the greater good of the community to be able to lower our COVID rates. As we lower those rates, everything changes on those recommendations. So even with the CMS guidelines and looking at the percent positive, as those numbers come down and that percent positive comes down, that means more opens, more visitation, more ability to be able to do that. As those numbers come down, it means the schools are able to open up more classrooms and to be able to allow more kiddos back in school. It means if we bring our issues under control, we are also able to celebrate that with our businesses and really promote that to those around us who are looking for places to be able to do their business and to really work with our Economic Development Council and encourage that. What I have right now is I have the feedback from our community leaders. What I wanted to ask of you this evening is to ask for your feedback. What is your feedback as far as what are productive ways from citizens that we can move forward as a community, and not just the health department, but as a community as a whole, who should we be working with? What do we need to make sure that we are covering? And how do we go about making those connections so that we can start making meaningful impact in order to bring the level of COVID down in our community? Because it will be for everyone's benefit to be able to get business up and going and really keep this county moving again. I think we can get there. And I think that shows in the numbers that we are seeing over the last couple of weeks. And so with that, I will turn it back over to Dennis as far as community discussions, but I appreciate your time tonight to lay those information out.
Okay. Thanks, Director Vollmer. Thanks for your attention, everybody. I think that's important information for everybody to have. So our next item on the agenda is visitor and guest remarks. I want to remind folks about a couple of things. We've allotted an hour, up to an hour for this. Everyone will be allowed 3 minutes to make their comments. So you can keep an eye on the timer there as far as how long you have to speak. I have two different lists here of folks who have asked to speak. One is from our, for the emails we have received. The other is for the people who've signed up tonight. And some folks are on both lists. So I'm going to go down the list of people who sent in an email. Some folks may not be here. Then I'll go down the list of folks who signed in tonight. And if for any reason we miss someone who may want to speak, just let us know at the end. And everybody who wants to speak will have an opportunity to do that. And I apologize ahead of time if I mispronounce anybody's name. And one other thing, this is intended for us to hear your comments. This isn't a discussion. It's not a debate. We want to hear what you have to say. And so that's what we're asking, is that you give us your comment. And I think, as Kelly said, we're hoping we're going to hear some things that are going to help us move forward with this whole situation.
Microphone's off.
Sorry. Okay, starting with the list from the email that we got. First name is Suzanne Martin. Is she here? Okay. Just step up to the microphone, please, ma'am.
Hello, my name is Suzanne Martin, and I live and own a business in Jefferson County. And as a small business owner who's been on the front lines dealing with this virus since the beginning, I took this virus very seriously from day one. After all, my family and my employees and their families' lives were on the line. Now here we are 7 months later. I'm here to tell you that masks don't protect anyone from this virus. We've been delivering to 30 long-term care facilities across the state of Missouri, including 2 here in Jefferson County. One by one, we watched each of these facilities was infected with COVID. My nurses were all avid mask wearers. All of them wore masks. Most of them wore N95 masks everywhere, all the time. As they all started catching the virus and returning to work, I decided I would start doing my own on-the-ground research. 100% of all the nurses infected with coronavirus wore a mask always. Not one of them took any vitamins or supplements, like myself and my drivers did. And all were very sick, but did recover without any time spent in the hospital. Needless to say, none of them believed masks protect them or anyone else at this point. Everyone I spoke with is completely baffled that the CDC's own Dr. Redfield says masks protect people better than a vaccine, yet the CDC's own data does not back that either. The CDC's data out of 154 patients tested positive for coronavirus in the previous 14 days before their illness began, 71% used a cloth face covering always, 14% wore a mask often. That equals 85%. Only 4% didn't wear a mask at all. So basically what I'm saying is, I think if you want to help people, we should talk about the vitamins and supplements that have been out there for months on how much protection that can give you. I'm living proof of that. I've been going where COVID is every day since it began here. I've watched horrible things. I've watched people die. I've seen people have to throw bodies out on the sidewalks basically because the funeral homes don't want to come in and get them. They're all terrified because I feel that there's being a false narrative pushed. And I think that some real help would be great if we could pass on the vitamins and supplements that even the president's wife, First Lady, had great success with. Thank you.
Thanks.
If you have a device that's going to be playing, we just want to be respectful and have the ability for people to hear. Thank you.
If you folks in the back are having trouble hearing, if you want to move up to any of the empty chairs, you're welcome to do that. Okay, next name I have on the list is Sue Irby. Is Irby not here? Okay. Okay, the next name on the list is Peter Irby.
All right, then I wanted to thank you for your time and attention in addressing this issue. The words that I had to speak on this are a little different because I was gearing up for a battle on the mask thing, but you're not putting a mandate on there, so I'm kind of winging this. So the first thing on here is the Jefferson County numbers per 100,000. The number of stores that required masks per 100,000 started going up at the end of July when Walmart, Lowe's, all the big stores, Schnucks, all of them started requiring masks. Now, the way I see it, if these masks were incredibly effective, our numbers should have started going down starting at the end of July. But instead, we started seeing problems with them going up. If these masks were the wonder that everybody thinks they are, these numbers should be much better than that. So I'm just not plussed with the mask as a situation at hand, being a big cure-all. What I've done, I work at a credit union. I see a lot of people every day. And for years, I've been taking vitamins, and I take zinc, vitamin C, and vitamin D. I know for a fact that I've run into people that had COVID. I didn't get it. The vitamin C, vitamin D, and zinc, just taking what you eat, making sure you get your vitamins, your zinc, and wash your hands, to me seems to make a heck of a lot more sense than wearing these masks. Because the CDC can say what they want. In March, they said they were great. Now they said they were awful. Now they say they're great. Later on, they may say they're awful. But how in the world can it be good to wear this thing over your mouth all day long, keeping those germs in? If you have that COVID, you're going to keep breathing it in and out. And if you're not, you're going to get other ailments. It's just, this mask just doesn't make sense to me, not at all. And my third point is the masks are killing the small businesses far more than the big ones. You look at Walmart, Lowe's, all those guys, they might be losing some business, but they're doing okay because they've got pick up by the curb, stuff like that. They can work around it. The small businesses like Karsh's, restaurants, things like that, people don't like going to restaurants with the stupid masks on. They just don't. I see them at the restaurant I work in St. Louis County. The restaurant next to me, where is everybody? On the porch, where they don't have to wear the darn mask. You put a mask mandate in, it's just going to crush them. There's no reason to put a mask mandate in there. And I know you're not putting a mandate on there, but I just got to get this out. Putting a mask mandate out there is just going to crush the small businesses. A lot of them barely got through the last shutdown. It just doesn't make sense. But to me, the ideal way to get through this is, like Suzanne said, zinc, vitamins, personal hygiene, and just make sure you take care of yourself. And one thing I think people need to keep in mind is when we started all this prevention, the government's intention was never to kill this off completely. You can't do it. It's a virus. It's always going to be here. The flu has always been here. The idea was to flatten the curve. I think we've done that. And I think the goal that we need to keep in mind is keep this under a rational growth rate. Is it way out of control? Are people dying? I mean, like, if you didn't see this on the media all day, every day, would you really know that there is a crisis going on? I don't think so.
Okay. Thank you, sir. Please be cognizant of the time when you're speaking, if you will, please. Okay. Eric Finkelstein. Just left. Okay. Chad Miller. Okay, Marcella Povis. Jamie Cheney.
Hi, I'm Jamie Cheney, and I live in Arnold with 9 of my 11 kids and my husband, because 2 have flown the coop officially, sort of. They'll come back for Thanksgiving. Thank you. So I'm here to talk about, I know you said you weren't going to mandate masks anymore, and I'm really grateful for that, even though everybody wears them everywhere anyway. But I'm here to represent people that have medical reasons that they cannot wear a mask. And 5.5 years ago, my oldest son, he's a senior in high school. He very suddenly overnight became sick with autoimmune encephalitis, where his immune system attacks his brain when he is exposed to a strep infection or gets a strep infection. So my issue with the masks is they increase the risk of bacterial infections. And his doctor in Ohio, he has to see a doctor in Ohio because no one knows how to manage his care here, his doctor was so concerned about my kids wearing masks at school that we homeschooled my 5 children that are in grade school. And I'm really glad, because their small parochial school had an outbreak recently of 30 kids with strep, basically in the same time period. And that has never happened before. My kids have gone there for years, since my 21-year-old daughter went there. So I was kind of hoping you could maybe start collecting data on sinus infections, strep infections, staph infections on these kids having to wear masks while they sweat and do kid things at school. My 3 high schoolers did want to go to school really, really bad. So I let them against my better judgment. Within 3 weeks, all 3 had staph infections. 2 of them had impetigo up inside their nose. They had never had impetigo even as little babies, including my son that has a history of staph and strep encephalitis. So thankfully he was fine. We treated him. My other daughter also had a new outbreak of herpes simplex 1, which is cold sores, but she'd never had them before. And it wasn't like around her mouth like usual. It was right up inside her nose. So my concern is we could be trading off one sickness for another in kids that have to wear them long periods of time at school. Thankfully, their doctor wrote them a mask exemption. They know to socially distance. We have been aware of germs for 5.5 years now, because I am finally not living in terror of strep anymore, because my son's doing really, really well. And I guess I would just like to put this out here, that if you see someone walking around at Walmart without a mask on, even if they look perfectly healthy like me, they really could have legitimate health reasons that they don't have it on. And it's not that they want to kill anybody or get anybody sick. It's just individuals have different health needs. And can I throw in the vitamin D3? Could we talk about encouraging doctors to test serum vitamin D levels, because I have to take 5,000 IUs of vitamin D3 in the summer and 10,000 in the winter. And it really, really helps with illness. So
Okay, thank you.
that was it. Thank you.
Okay, Jennifer Nolan. Carrie McConnell.
Hi. I'm here on behalf of my employer, The Ridge Bar and Grill in High Ridge, and a few of our patrons that are regulars. Many of our patrons rely on us for their socialization along with their meals. Some of these people live by themselves. They don't have any close by relatives to, rely on. So as an employee, I've watched my boss in tears regularly since the start of this, sick with worry about how she's going to pay bills and her employees. I've watched her lay off employees, absorbing the hours herself, struggle to decide if she should be able, or if she should renew our liquor license or close the doors. She's used her savings to keep the business open, shorten the hours of the business, watch several regulars stop coming because they're terrified. As employees, we've lost hours, wages, worried about whether we were going to have a job, worried about paying our bills, and any measures keeps people from coming in. As a business, we've lost 40% of our revenue since the start of this. In fact, we're barely able to pay bills, leaving us wondering if we will be able to stay open another week. Measures would cause us to close doors. I want to touch quickly on the CDC study that showed that 85% of people wearing the masks were the ones that had gotten COVID within a 14-day period. In October 5th, several international epidemiologists from Harvard, Oxford, Stafford universities put out a declaration co-signed by over 1,700 medical professionals, including scientists, to reopen society and resume normal life. They stated that herd immunity should be the goal and could be accomplished in a short period of time. Also, one of the World Health Organization's special envoys on COVID-19, in a recent interview, appealed to the world leaders to stop using lockdowns because they're devastating economies. And he also warned that social distancing can be highly disruptive and may do less than most people think. So that's basically all I had to say.
Okay.
But thank you guys for your
Thank
time.
you. Turn that up. Can you turn that up over?
There is no PA mic.
Oh, okay. Okay, I'm just hard of hearing, I guess. It-
Live broadcast only, folks. There is no internal broadcast. We ask that you please project so you can be heard. But you're close to the board.
So that don't work.
That's not.
Yes, it does, sir.
Okay. Oh, okay.
Okay, next is Amber Zykan Finkelstein.
Yeah, somebody else has to use that microphone after that person? No.
Yeah.
You're not taking your mask off.
Your mask is doing such a good job, you shouldn't worry about it.
All right, let's go. Amber Zykan Finkelstein, is she here? No, okay. All right. This next list, first person's Peter Irby, he already spoke. Nancy Brigham? Is that name correct, ma'am? Okay.
I also came here expecting that it was the mask mandate. And I want to share a story. My daughter has a friend whose mother was in the hospital and with COVID. And the oxygen level was dropping so far that they called the family because they felt like, she probably was going to die. And they were placing her on a ventilator, but it was bad. And so they wanted the family to say their goodbyes to her and talk to her and love on her, as we all need, and not be isolated. And they spoke with her and told her how much they loved her and how important she was to them. And the oxygen level raised enough that she was not on the ventilator, and eventually she came home. They did not do that. I've worked in nursing homes, and I am a caregiver. What has happened to our elderly is a travesty, and I'm angry about that. Now, people do die of a broken heart, and I do not believe that those elderly lived longer because of isolation. I believe these people died of a broken heart. And I don't believe that locking those doors up protected anybody and locking them down protected anybody. I do not believe that. I don't buy it. We've dealt with this 8 months. CDC and WHO have contradicted themselves a number of times. My daughter's mother-in-law went in the hospital. She has pneumonia on a kind of a regular basis. Her immune system is compromised. She is elderly. And so she went into the hospital kind of at the regular time with the same symptoms she has had for years with pneumonia. Not really struggling to breathe, but she went to emergency so that she could be checked out, whether she needed to be in or not, she wasn't sure. And they walked in the room. I won't name the hospital because they walked in the room and immediately asked her if she wanted to be placed on the ventilator. I hope that the nursing homes open up. I really do. And I hope that we can all be more kind to each other and just open up, get the masks off. There's so many people afraid. And, that's a death sentence too. Okay. The isolation and the stress and anxiety on people is a death sentence too. I'm more concerned about people's mental health and their business loss and their lives being destroyed by this. It's not right.
Okay.
There's not enough people that have suffered.
Thank you, ma'am.
That should happen.
Okay, David Day.
I just want to say that I find this whole thing very interesting. When the COVID stuff started, it was about 6 feet apart. Then it became mask. Now it becomes about 6 feet apart, mask, everything. It's gone way over the top. I'm 67 years old. I've never worn a mask. I hug. I do everything. I just don't understand this deal where you're going to die, because that's just it. Kelly, you're doing all this testing out there of people that aren't sick, which I find insane. You're talking about restrictions at one time. I mean, tonight you're not. Glad you're not. But you talked about restrictions and masks and the rest of it.
Point of order, Mr.
I'm
Chairman.
here to speak.
Mr. Chairman, point of order, please stop the thing. Can we not have personal attacks, please?
Excuse me. We don't want to mess it up. I hope people can hear me, because I know I couldn't hear a damn thing back there. So anyway, back to what I was saying. You talk about restrictions. We have, they got restrictions in St. Louis County, St. Louis City. Businesses are they're going out of business. And that didn't seem to be a concern of yours. It just didn't. It really bothers me that we're going to go ahead and, you try to push this. And then what was it, less than 2 months ago is when you did that little fiasco where we're going to do a resolution and then you turn it into something else. And now then the legal team left you because you weren't doing the legal thing to begin with, which, you know, I don't understand. You know, when that kind of behavior's there, people should get fired for that. They really should. It wasn't a mistake. It was calculated. It was on purpose. But I'm here for all the people of Jefferson County. This is all insane. I feel like I'm in the nut house here. I feel like I'm ready to take off for orbit with this silly face shield on. I couldn't speak before because of the fact that I had to wear a mask, and I still don't understand why people are standing here and they can't take their mask off so we can hear them. I couldn't hear 80% of what you were saying. And I find it fascinating, though, that you want to continue doing this. And then tonight it's like, well, we're not worried about the restrictions. You don't have any restrictions. We have restrictions in this building right now. It's insane. We all these people here have to wear a mask. Why? We're socially distanced, which is ridiculous. I mean, why am I not sick? I led a rally back in March where nobody wore a mask, and the people were saying, I hope you die. None of us got sick. So, you know, the people that get sick are usually older. They have underlying conditions. Those are the people having problems. Everybody else, let's stop this mask garbage because it's not helping anybody. And frankly, it's time we go back to normal. And if people want to do it in St. Louis County and St. Louis City, good for them. But here in Jefferson County, we want to open up, go back to normal. That's what it should be.
Okay, I'm having a little trouble reading this name. Alan Lederbrand? I'm sorry. What is it, sir? Lederbrand. Okay, thank you.
Thank you for the opportunity to speak to you tonight. I agree. There's been so much miscommunication, and from the CDC, World Health Organization, 1 minute's one thing, you wear a mask, no, you're not. But masks don't help. I mean, if you actually look on the mask that you buy, it says it doesn't protect you from the CDC because the virus will actually go through the mask. So what's the point? I understand, you know, if you're concerned, keep your distance, wash your hands. But if you go into a restaurant, if we were in a restaurant right now, nobody would be wearing a mask. You'd be all sitting down at your table, not having a mask on. So it's like he said, why are we wearing a mask right now when we're so far apart? But the thing is, what bothers me is the fact of people's mental health. All jobs are important, are critical. Nobody, when they came in and said certain job, you know, businesses had to shut down because they're not critical, every job, because people have to pay their bills. So why are we shutting businesses down? Give them the information, let them adjust. Businesses will adjust. And as a free individual, I can make a decision whether I want to go into that business or not. Do I want to wear a mask, or let the business decide? If you want to come in and patronize my business, then you have to wear a mask. And businesses will decide whether they want a mask or not. But to me, and for me, if I don't want to wear a mask, then I'll go to a different business who doesn't require it. But I just think that these masks are silly, because they cause, you can't breathe, you get infections, you're maintaining that moist, you know, disease, your body's fluids are being accumulated in the mask, in your nose, if you're wearing for a long period of time. So the people who are getting sick, which is what the CDC came out, is because the people are wearing masks. Instead of breathing fresh air, you're breathing recirculated, you know, diseased air. So I'm just saying is the masks don't work. If you want to wash your hands, keep the distance, don't hug, you know, encourage people not to, you know, shake hands right now or bump elbows, which we normally do. But I've been out all over, and I haven't really come across anybody who's had the disease, and nobody's getting sick because we kind of, if I don't know you, I just keep my distance, is what you should be doing in this kind of, you know, with the epidemic. But for the kids in school, they're going to be going crazy. The kids are in school are more likely to die from the flu than they are from COVID. So, you know, we're locking down. So when the flu season comes in, are we going to increase the mask state more because we're worried about the flu? It's just a waste of time and a waste of effort. Thank you.
Thank you. Okay, Tonya Lovelace. Okay.
Hi. Okay. This. Okay. I was asked to read this by a person that was on the list that can't come in because of the mask.
Who was that, ma'am?
Christina Ginn. She asked, one of the questions that she asks is there a financial incentive to pass a mask mandate? Pardon me? No, there's not. Well, thank you. That was one of the key questions that she had. And, well, the companies that are making the masks are definitely making money. The CDC put out a report, and this is very important. 80% of the people that are wearing masks, 80% of those people, out of 100%, 80% of those people that were wearing the masks came down with COVID. So that's telling me one thing. That's here in the United States. Internationally, the statistic was 70%. So that's telling me the masks are not working. And I agree 100%. We need to do something to protect the citizens of Jefferson County. That's what I want to see. Okay, there's a lot of research out there, and that somebody already mentioned the vitamin D. There's a vitamin D study. We are in America strategically and very specifically low in vitamin D, and vitamin D is one of the key elements that we need to fight off viruses. What are we doing for our elderly citizens that are in the nursing homes to help protect them? We need to have, not only do the nurses need to be washing their hands, the patients, the nurses need to be washing their hands too. I can't begin to believe the times that I've seen a person that's working in a health facility pick something up off of the floor and want to use that item on me. I was offered a box of masks out there. The box was filthy. I wouldn't put my dog food in it. And they were telling me that the masks were sanitary. No, they are not. Don't offer me this is the health department. Don't offer me a mask made by human hands. I don't know if they were wearing gloves. I don't know if there's animals in that home where they were made. I have allergies. I have asthma. That's why I was so sensitive to, I saw when you came in, Susie, that your breathing was labored. I saw that immediately. You know, I am very concerned about what we're doing to our children. We're telling our children, cover up your face. Don't hug people. Put them in this acrylic box in their classroom. I'm a retired teacher. I'm appalled. I am appalled. What are the psychological ramifications when those kids are 14, 15, 16, 17 years old? What are we doing to them long term? Because we're isolating them and we're saying, don't touch this, don't touch that. We need to be teaching the children how to be healthy, overcome. Instead of all this money going to buy billboards with people wearing face masks, I would like to see some money put into supplying maybe vitamin D or getting vitamin D levels checked on people. Abbott has said that the testing is inaccurate because the tests are no better than the person that is running the tests. And if they are spinning those specimens down too much, you get false positives. So we need those things addressed.
Thank you. Okay. Greg Zoda? How do you pronounce it, sir?
Greg Zotta,
Zotta.
Z-O-T-T-A.
Thank you.
Kelly, you mentioned there was no mask mandate, and yet we all had to wear masks to come in here. So is there a mask mandate or not a mask mandate? The other thing is they say, follow the science. We need to follow the science. Well, per the CDC, just this week, they did a study, 70% of mask wearers got infected with the China virus. Up to 85% wore the mask sometimes. This disease has a 99.96 survival rate per the CDC. Dr. Fauci and the Surgeon General said back in March, masks were ineffective. The numbers are going up because everybody's getting tested. You got football players now, you got college football, you got NFL players. They're testing them just to test them, not because they're sick. You had Kelly McEnany. She's in quarantine now because she was tested because contact tracing, and she's not sick. They only need to test people that are sick. My daughter-in-law, she contracted the virus through contact tracing. She had to go get tested. She had a headache for 1 day and lost her taste and smell for a couple of days. That was it. Her husband, her children didn't get affected. So I believe we just need to just get on with our lives like we were before this Chinese biological warfare hit this country and hit the world. You just get on with our lives and do what we used to do. If you get sick, do what you need to do to get well. Hydroxychloroquine does work, but they destroyed that because they don't like Trump. One thing I would like to find out, these tests, I just read an article, they're making money, they're charging Medicaid and Medicare anywhere from $20 to $850 per test. How much are we charging the government for these tests? Do you know? I would like to find out, put it on your website. That's all I need to say.
Thank you.
Sorry. I just wanted to address, we receive our tests from the federal government. They come in through the state and are distributed to us. So we do not charge anybody for their COVID tests or for their lab running. So just on our end, I can't speak to what the other labs are doing.
Carrie McConnell. Oh, I'm sorry. Yeah, I'm sorry. Okay. Jennifer Rubel.
Hello, my name is Jennifer Shepard-Rubel. My husband and I live in Festus with our 2 children who attend Hillsborough High School virtually. And by the way, my virtual kiddos are doing just great. My family has lived in Jefferson County since the 1950s. Throughout my career, I've always worked in St. Louis County, but I continue to make Jefferson County my home. So please, as I speak with you today, understand I have a vested interest in the health and growth of our community. First, I'd like to thank the director and the employees at the Jefferson County Health Department. I too work in healthcare and can relate to how chaotic and challenging the last 6 months have been. You are doing a good job investigating this complex path of this pandemic and its impact on our community. Second, I'd like to address the board. I have been present outside at some meetings and I've watched them all through Facebook. And while I'm very pro-mask, I would think that people on both sides of this issue would agree the behavior during some of these board meetings is extremely disturbing. It is not productive to the imminent healthcare crisis in this county and it's facing our country. It is extremely unfortunate that COVID-19 has turned our community and all of us into an us versus them mentality. It's not about that because we all have to work together to defeat this. I am here to plead with the board and community members to please wear a mask when you're in public. Limit your social gatherings and practice social distancing. Please wear a mask, not because of the mandate or a lack thereof, but because you care about other people. The Bible tells us to love thy neighbor. Wearing a mask in public shows that you care about others. You care about stopping the spread of the virus. This is a mitigation effort that has been proven to help lower cases of COVID-19. Even a homemade cloth mask like this one, made in the USA, you can buy them on Amazon. I wear it once and I take it home and I wash it. I know many of you here are anti-mask. I'm extremely outnumbered. I get that. But I can assure you, no one is taking away your liberties. When you don't wear a mask, you are taking away the liberties of others. Yes, you are.
Let her speak, please.
Finally, I am asking this board to change their course. You are here to make informed choices to better the health of Jefferson Countyans. And please start making these smart choices soon, because being in the orange is not a good thing. Thank you for my time.
Thank you. Okay. Rick Lamborn, sorry. How do you pronounce your name, sir?
Lamborn.
Lamborn?
Lamborn from Fenton.
Okay, thank
The
you.
good side of Fenton, the Jefferson County side. But I'd like to thank the board for your service. I mean, it's a thankless job. You're up here getting hammered by a bunch of people. But you care about, hopefully you care about our opinions. You certainly seem to. Also value the people that have showed up here tonight, both for and against, but to share their opinions. But I value freedom probably more than a lot of people. Had family members fight for our freedom, and very important. I do have a question. What exactly is the positivity rate? What is that numbers divided by?
When you're looking at the positivity rate, you are looking at the total number of positive cases in terms of the total number of cases. So the positivity rate is your total positive cases as a total of your whole, all the testing that's been done. So the more testing that's done, it generally tends to bring it down. And then less testing will tend to take it up.
How come I don't really hear anybody talk about the rate of, as a percentage of the population? I mean, the numbers I'm looking at off your own website, now this may not be totally current, but 5,339 positive cases. Is that correct or close enough?
Correct. And just so you know, the color coding that happens within our time, and I apologize, we will add to your time. The color coding that happens within our that we put onto our website is per population. So that 25 per 100,000 population, that's how we distinguish it so that you can see a difference.
Yeah, but if you take the whole number, the total population of Jefferson County is a little over 225,000. The way I do my math, that's 2.4% of the people have tested positive for COVID. And to take the death rate of 71, that's 0.03%, 0.03%. That's 3 out of every 10,000 people. Not making light of the disease. It's not a good thing. But also the good news is from people in the healthcare that pneumonia is down. Nobody's dying from pneumonia. They're dying from COVID. There's nasty things out there that are going to kill people, unfortunately. And also, with, the mask mandate, people trying to stay inside, and the vitamin D thing. I mean, being outside is probably one of the better things for people. And yet, people are told to be inside, especially kids. I don't got to play, don't want to go out and socialize with their friends. So what do? Stay inside, hang out. So they're literally kind of losing the natural vitamin D that they can be getting. So I just go along with, freedom is way more important. Being told what to do, especially when it comes to a mask, is not very nice. It also impedes communication. Communication, I've heard, is less than 10% verbal. So if you can't, you can't see my expression, you don't know whether I'm happy or not. You don't know whether I'm sticking my tongue out at you or not. I'm not speaking to anybody in particular, but you're really, taking away freedom of speech if in fact verbal with only 10%. So I just thank you for your time, and please don't do a mask mandate. Thank you.
Thank you. Gary Bosler.
Can I talk to you or can I talk to them? Well, what I'm about to say, I see the news people are gone. Well, they're not gonna put this on television anyway if I said what I'm about to say. They knew about this stuff all the way back to 2001. We've been making these viruses, about 15 of these special labs in the United States. They make these viruses. The one that we have now came from North Carolina, SARS. The Chinese were gonna steal it from North Carolina, Fort Detrick. So instead of doing that, they bought the laboratory and they took it back to Wuhan. Wuhan's not a little city neither. It's got 15 million people living in the city, plus another 60 million on the outskirts. Well, what needs to be done? We need to shut these laboratories down all over the United States and in the world, or they're gonna mess up, and it's gonna kill every man, woman, and child in this country. So we've been developing these viruses for years, all the way back to Ronald Reagan. Look it up on YouTube. I want you to look up Dr. Francis Boyle, B-O-Y-L-E. He's a professor of law at Chicago, Illinois, and he's an expert in these diseases. He was on the Bush administration, and he's known throughout the world. He was on Channel 2 News one time in 2001. And he's banned from all television stations here in the United States, all radio stations, and BBC in Europe. They don't want you to know what they're doing. They're making these viruses. Well, if you look it up on YouTube, Gates wants to weaponize mosquitoes. Why would somebody want to do that? You know, that's kind of stupid. I mean, it might bite you too. And you're the doctor on the panel? The only doctor?
She's not a doctor. She has a social science degree. None of them have any medical background.
Oh, okay.
Not one.
Okay, can I ask one?
I stand corrected. What's your background, please?
I worked at Jefferson Regional Medical Center.
Okay, I just want,
Thank you, sir.
I
right.
just want to ask him something.
They don't have medical research.
You can do that later, sir. Okay.
Classes, there was a retirement home down there that they got the virus bad. Was there any follow-up?
Your time's up, sir. You can speak to them later.
One of the guys got out of the wheelchair and went over one arm and came back. Yeah, that's stupid. It sure is. Look it up on YouTube. And pass it on.
Bill O'Brien.
They're lying. All of them lying to you.
Okay, sir.
Okay. Just name off some things here. Thanks for your time tonight. 87 and 94% of positives are false positives. I think that erases the pandemic. That's from Elk Day Clerk, general practitioner and founder of Doctors for Truth. We are the David in the story up against an even bigger giant than Goliath, the mainstream media, globalist. God help us. World-renowned neurologist Margareta Grease-Brisson warns masks cause oxygen deprivation and permanent neurological damage, especially in the developing brains of children. And I am a father of 3 sons, 2 of which are at Festus, and I'm doing the virtual learning with them, and the other one has graduated. The re-inhalation of our exhaled air will, without a doubt, create oxygen deficiency and a flooding of carbon dioxide. We know that the human brain is very sensitive to oxygen deprivation. There are nerve cells, for example, in the hippocampus that can't be longer than 3 minutes without oxygen. They cannot survive. The acute warning symptoms are headaches, drowsiness, dizziness, issues in concentration, slowing down of reaction time, reactions of the cognitive system. However, when you have chronic oxygen deprivation, all of those symptoms disappear because you get used to it. But your efficiency will remain impaired, and the upper and the undersupply of oxygen in your brain continues to progress. For children and adolescents, masks are an absolute no-no in school. Children and adolescents have an extremely active and adaptive immune system, and they need a constant interaction with the microbiome of the earth. Their brain is also incredibly active as it has so much to learn. The child's brain or the youth's brain is thirsting for oxygen. The more metabolically active the organ is, the more oxygen it requires. In children and adolescents, every organ is metabolically active. To deprive a child or an adolescent's brain from oxygen or to restrict it in any way is not only dangerous to their health, it is absolutely criminal. Oxygen deficiency inhibits the development of the brain, and the damage that has taken place as a result cannot be reversed. I wish I had more time because, ladies and gentlemen, the very word secrecy is repugnant in a free and open society, and we are, as a people, inherently and historically opposed to secret societies, to secret oaths, and to secret proceedings. But I'm asking your help in the tremendous task of informing and alerting the American people. Confident with your help, man will be what he was meant to be, free and independent. JFK. Thank you.
Yeah, take them off the kids at school. That's unacceptable.
Okay, Renee Lopresta.
Thank you, Director and Board. I thank you for your time. I've lived here all my life, like everybody else, and I appreciate the work that you all are doing. I want to thank you, first of all, for listening to your neighbors, even if it is for the third time. And I also want to assure you that because you're here in our county and you are our neighbors, I would way rather hear from your recommendations than the federal government. So please listen to us and take that into consideration. You're here for us. We don't need the Fed coming in and telling us how to run our county. We will trust that you will make good decisions for us. I just more have questions than anything else. I feel like I'm watching, after living in Texas for the past 3 years, I just came back into town about a couple of months ago, and I feel like I'm living in the hen that cried that the sky is falling. I have a 68-year-old aunt who's morbidly obese. She uses inhalers daily for her severe asthma. She came down with the COVID. She was treated with the same protocol that the president told us about back in April. She was down for 4 days and she's fine. I would like to understand, we keep arguing about whether or not to wear a mask. Why don't we argue about whether or not this is even important? We've listened to the statistics. I'm asking you again about statistics. We're looking at the death rates, and a lot of times this isn't much more than a common flu. Yes, I agree that sometimes those symptoms can be bad, and people with comorbidities are more greatly affected. But what I would like to understand is, how many school-aged cases have we even had in this county? Even after the school resumes, you yourself just told us that those rates are going down. And yet these kids are sitting in plastic boxes with masks and can't even understand what the teacher's trying to tell them because they only get this part of the picture, which is a shame. I also wanted to understand how many of the deaths in Jefferson County are related to COVID that have no comorbidities. because I think, again, we're chasing our tail trying to cover ourselves with masks when people with asthma are walking away with this that should have died or at least been on a ventilator. She wasn't even hospitalized. I also would like to know when we're going to be able to see herd immunity, and are you monitoring for herd immunity in Jefferson County? And how are you able to track that? Thank you.
Okay, Doug Pass. As he's coming up, folks, does anyone else want to speak that whose name I haven't gotten? Two more? Okay. Anyone else? Okay, thank you. Okay.
I've got good news, and nobody mentioned a technical factor. There's two major studies about vitamin D levels. The one is from Iran, and it was chaired, ironically, by a doctor from Boston University. They found in the sandbox, in the very sunny Middle East, that's desert fundamentally, that patients that had even 3 comorbidities over 70 years of age, that if they cranked up their vitamin D level to 40 nanograms per milliliter, they went from a 20% death rate, almost certain, very dire ICU, ventilator, eventual death. The ones that they tested their vitamin D levels and got them back up to 40 nanograms per milliliter, which the endocrinologist recommend now 30 nanograms per milliliter. That's by and a similar study in Spain. I'll send it to you if you'd like. But anyway, they have, that will cause the very minimal reaction. Now I want to shift gears because everybody should get their vitamin D levels checked, because people who think they get adequate sunlight and have adequate vitamin D levels. I know personally a doctor who teaches doctors worldwide who's taken 10,000 international units and lives in sunny California and is out in the sun frequently. Tested his vitamin D level live, I see, and he was only 1 minute. Now, the second thing I want to cover quickly is RT-PCR. And the RT-PCR, very briefly, if you go past 37 cycles, you can't grow the virus. The real backup test to a positive is if you can grow a virology culture. Now, every great lab knows you run a backup test to your main test. So basically, a PCR is a great screening test, because if we take it out to 40 or 47, right now there's no regulation by the CDC or FDA. Private labs can go to whatever level they want to and tell doctors it's a positive without telling them how many cycles they went to obtain that positive, which to me, I never understood that, because I'd always tell the doctor what the results were. Okay, that's my own timer, I said. But anyway, that basically viral cultures don't grow beyond 37 cycles. So basically, anybody who's caused a positive past 37 cycles is actually an ipso facto negative. So they should not be reporting of greater than 37 cycles. Dr. Mina from Harvard, Harvard MD, PhD epidemiologist, says it should be 30. That's a little shy. If we can still grow a virus in the lab as a backup test to prove that it's a real live virus that's present in somebody, that's a real positive. But past 37 cycles, to answer your question.
Thank you, Doug. Your time was up. Thank you.
Okay, who'd like to be next? Yes, ma'am. Get your name and where you live, please.
Linda Vandereet, 7912 Jim Weber Road, Eureka, Missouri, 63025.
I'm sorry, I didn't get your name.
Linda Vandereet.
Okay,
Good luck with that.
yes. Could you sign
You
in?
asked what we want from you. What we want from all of you is to get out of our lives. Stop telling us we need to wear masks, that we need to do this, social distancing and all this other crap, and get out of our lives. I am an adult. I'm 58. I'm older than you. So I don't need someone sitting on some board telling me you need to do this and you need to do that. When I walk out of here, I don't wear a mask. I have a business. I don't wear a mask there. I don't wear a mask anywhere. I don't wear a mask in Walmart. I go into Home Depot. I don't wear a mask anywhere. I'm still alive. Believe it or not, I'm still standing here. I have not been sick. If I get sick, I'll take care of myself. Like I took care of my children, like I take care of my husband. I don't need a bunch of people that don't know crap about my life telling me what I need to do at 58 years old. I don't need people in the audience telling me I need to do stuff. I don't need anyone telling me what I need to do because I've raised myself. I know what I'm doing. If I get sick, it's on me. Like it's on me for pneumonia, like it's on me for flu. I take care of myself, or I go into the doctor. I don't need you telling me I need to go to the doctor. I don't need you telling me. I don't need any of you. And I've been living in Jefferson County for 30 years. And I've never come to any one of you people and asked you for your opinion or what I need from you or anything. I take care of myself. And that's the freedom in America. We don't need health departments. We don't need health departments telling us anything. A group of people that don't know our lives, don't know how we live, telling me, you are telling me I need to wear a mask. No, I don't. I don't wear a mask when I leave here. I don't care who you are or what your medical expertise is. I could care less because I've lived all these years without you. I've taken care of a mother who was sickly, very sickly. None of you were there. None of these people were there. I was there. I didn't need their help. I didn't need any of their expertise or any of them telling me advice about what I need to do with my life. And I took care of my mother till she passed away. Believe it or not, without you, any of you. So we're not in all this together. That's a bunch of bull. I live my life myself. I don't need you.
Someone else here to speak? Oh, I'm sorry, ma'am. Okay. No, go ahead. And I'm sorry, what's your name?
Lola Donahue.
Okay, and where do you live?
I live in Jefferson County.
Okay, what city?
I'm sorry,
What city?
City St. Louis. What do you mean? I live in Jeff County, Missouri.
In Festus, Crystal City?
Barnhart.
Barnhart.
Sorry.
Thank you. And I'm sorry. Then
Clearly, I don't know where I'm from even or
I
what's
lost
going
your-
on.
I lost your name.
Lol. Ma'am, do you mind?
Go ahead.
Thank you.
I'm sorry.
My name is Lola Donahue.
Okay, thank you.
You're welcome. I thank you. I appreciate also the time. I was also under the impression, my husband and I, that we were going to talk about the mask mandate. So I apologize. It's a little bit different. So I kind of feel like I am in the opposite camp, and that's okay. I grew up here in Jefferson County. I went to Seckman High School, and I left to Chicago and came back here to open my own business, which I did in November. I have been very kind of sad and heartbroken, obviously with everything going on, but I think my message tonight specifically, after seeing kind of this, it just makes me really sad because there are a lot of people who believe in the mask. I don't like wearing masks, let me just say. I own a dance business, so this has killed my dance business in Manchester. So this has really sucked, but I thank you for the mask mandate. I think it should exist. I actually lost a lot of business because it was unclear. And I have friends in over 15 countries around the world that own dance studios. And it's just sort of disappointing that around the world, all of these people ask me how it's going. And this is what I kind of have to tell them, that we don't listen to each other. You know, I sat and I listened to everybody that was completely opposite of me, and that's okay. I actually appreciate everyone's opinion. But I just don't understand why we cannot listen to each other. This is not all your fault. Nobody wants to wear a mask, but we do appreciate it. And I think it's just sad that people not in this county are looking at us and they think that we're a little like crazy. You know, I have friends, like I said, all over the world, and they don't understand why we're not doing anything seemingly about it. So Susie, so this is the other thing too. I'm just a little confused, again, learning. I'm not in this arena, so I don't know. And I'm just confused about when we come to you with issues, why people are allowed to make comments, and I just don't understand. So that would be something I would like to have changed. I just feel like there are so many other people that feel the way that we do. Again, we don't like the masks. Let me be clear. I don't want to wear it, but I've lost business because of it. And my mom, who's a Fox C6 school bus driver, just got quarantined because her bus of kids are sick. And she's negative because she wore the mask and the face shield. So.
Okay, thank you.
Evening.
Could you give me your name and your where you live, sir, please?
I'm James Espy. I live in Hillsborough.
SB?
SP. It's spelled ES, P as in Paul, IE. And I think we know there is a virus here. We've had 215,000 people die in the US. And I think the biggest problem is it's out of our awareness. We can't see it. We can't hear it. We can't touch it. None of that. So it's invisible. But if we could see it, we would see it everywhere. Some people are asymptomatic. They may not have symptoms, but they can give it to other people. Children have a high viral load to where they can share that with people that they're in contact with later. That virus is here, and the only way to stop it is to isolate it. Like with SARS, they don't have a vaccine for that. They had to isolate it. They had to quarantine. It had to run its course. And once that course was over, it was done. And all they're doing is reinfecting other people with what we carry around. I did Meals on Wheels. I went to people that were already isolated and that social need that they had. We were there for them. We were their support. We went there every day and checked on them. I found one woman that had fallen, and if I hadn't been there that next day, she probably would have died. I mean, and they talked about a herd immunity. In Jefferson County, those over the age of 65, 30,227 people. And it's growing. And that's why I started doing what I'm doing. I went back to school after 45 years to take social work, to be here for support for other people. And there's so much different information out there. Who do you trust? Educate yourself, learn about it, read about it from reputable resources. I found a virus in a medical encyclopedia, and I know it's been around for a while. And when it was respiratory, I started studying on SARS and how to protect yourself from that way, even if it wasn't being recommended at that time. So it's all up to us, and we have to know that it's there, but we can't see it, and we have to take precautions. And with masks, it's not just the mask, it's the layers of protection. Thank you.
Thank you. We had one more?
I guess I'll say something.
Oh, okay. Let me check. How are we on time here, folks? Okay, so I'm sorry, sir.
Yep.
So we have 3 more folks? No, you're fine. I'm just checking. Okay. Sorry, sir.
No, it's okay.
Tell me your name and
My name
where
is
you
Mark
live,
Kim.
please.
Mark Kim. I live in Barnhart.
Okay, thank
with my
you.
wife. So I didn't really come and expecting to speak about the mask, but I thought I just wanted to say something just because of what I've witnessed here today, which is I think I'm just as shocked as my wife, and I just felt like I needed to speak out when I had the opportunity to do so. So thank you for that opportunity. My perspective on this is that we've seen all of this already happen before. When the US had its first reported case, South Korea literally had their first case as well. But what did South Korea do? They isolated and they wore masks immediately. They quarantined immediately. And what did we do here? We decided to politicize masks. We made it an issue all of a sudden. Instead of talking and being led by the science, which is everything about health. Everybody here does not want to wear a mask. I agree with everybody on that note. But we have to think about one another in this. There's no way that we can all separate and isolate from one another and think we can get through this. That is why we are here today. And I don't envy your position at all. It is a thankless position. But what I ask you to do is get past the politics of it and follow the nature, follow the science. People talk about their studies about masks. Asia's been doing it for years, and they've been successfully doing it. There's not.
Please.
All I'm asking you is get past the clutter. Follow what you know is right and lead in the way that you were meant to lead this community, because that's what you're there for. And all we ask for, all I'm asking for is to not listen to the noise and the personal issues and the attacks and try to do what's best for the community. And that's what's best for all of us. And that's wearing a mask and socially distancing and being responsible and kind to one another. That's what it's about. It's kindness. It's not anger. I saw people come up here angry. Why are people angry? We're all here trying to fix it. That's why we're here, because we care about each other. It's stupid to see anger through this. Everybody is angry, but we don't need to be angry with one another. What we need to do is listen to the science, listen to one another, care for one another, and do what's right. It's simple. Wearing a mask is an inconvenience, but it's there for you and me. That's all it is. And the sooner we do it, the sooner we get out of it. That's the fact. Thank you.
Okay, two more folks and that'll wrap things up. Yes, ma'am.
Hi.
Can I get your name and where you live, please?
My name's Jessica Shepard and I live in Herculaneum.
Okay, thank you.
I actually didn't prepare anything tonight. I wasn't planning on speaking to you guys because I've had the opportunity to speak to the board multiple times in the past. But listening to the comments tonight, I decided that I needed to come speak to you guys. Part of the reason is I've heard so many things that have been disproven, quoted here as if they're fact and truth. One example would be the study that found 85% of the people who tested positive for COVID out of that group had or were mask wearers. The interesting thing that nobody's pointing out about that exact same study is that out of the people in that group that tested negative, 89% were wearing masks. So your 85% number that you're trying to use to prove something proves nothing. We've all known masks protect others. The virus is spread from droplets. The mask over my face prevents me from spreading those droplets. It's literally that simple. I've heard people say things about oxygen deprivation. I wear masks multiple hours a day. I'm sure many people in the health department too. We don't have health department employees dropping like flies from lack of oxygen. It's not happening because it's not a thing. I just found out before this meeting that one of my friends who really wanted to be here to speak tonight isn't here because she found out that her daughter has COVID and they're quarantined right now. And the most likely source for where she got that COVID is her school. We listened to the director tonight tell us that the 19 and under age group is actually decreasing, and that's fantastic news. But what we need to take away from that is the director told us that those numbers are decreasing because of the measures that the schools have in place, because of the social distancing and the hybrid learning and the masks and all of those measures that they've taken to mitigate the spread of this virus. But I don't know if it's still taking place right now or if it's already over, but we just have right down the street at Hillsborough School District, they're having a school board meeting right now where one of the things they're discussing is ending the hybrid model at the school. How is that going to help things? We know that we have seen a decrease in the number of cases because of the steps the schools have taken. It would be insane for the schools to walk those steps back now. And we need this board to make the right recommendations to our schools for what they need to do. Thank you. And I don't appreciate your comments down there, Susie.
Thank you, ma'am.
If you don't have kids in school, you shouldn't be talking about school.
Okay, this is the last person. Last but not least, sir.
So my name is Chris Wagoner. I live in Festus.
Okay, thank you.
And I guess, first of all, I'd like to say that there's a big difference between people who test positive and people who are sick. I have 3 members of my family who were tested positive. 2 of us were never sick. And I kind of resent the fact that those numbers seem to be conflated, that we say sick people, and we always talk about sick people when we talk about people who test positive, and that's just not true. Especially when you're talking about the number of cases, instead of focusing on hospitalizations and people who are passing away. And I think the problems that we have had, and I know in my life, definitely, the quarantining and isolation is much more of a disruption than any symptoms we ever had from the actual disease. My daughter attends Southeast Missouri State. She came home over Labor Day weekend, and that's when we tested positive, but we isolated her so that she would not get it. SEMA would not take her back. We had to go through the Jefferson County, which I do appreciate that the Jefferson County Health Board did help us out. We had to say that she had tested positive just to get her in a quarantine time period so that she could get done with her quarantine time period so she could go back to Southeast Missouri State because they wouldn't take her back, even though she had isolated. So that the hassle of all the isolation and quarantine is much worse than the actual problems that the symptoms have caused. I have lost my job because of the fear that I believe this is a symbol of fear, and it causes fear among the populace, and you go into businesses, and if everybody's wearing a mask, it makes people afraid. And I think that is the biggest, we have much more problem with fear of the virus than the actual virus. As far as children, I would say that I do believe that the facts about that children having a high viral load I don't believe that's true. I believe that children have a low viral load and they are not very contagious. In fact, the last time I looked, there was somebody that was going through all the studies of college students, and they were up to over 110,000 positive cases in colleges, and at first they had 2 hospitalizations out of over 100,000 in college that tested positive. 2 of them were hospitalized. And I guess the only other thing I would just like to make sure is that you said that you do not want to do a mask mandate. And I just want to make sure we're not going to get a bait and switch after we all leave. Is a mask mandate on the table for what you guys are going to vote on tonight?
No.
Okay. Thank you.
What? Well, one thing I do want to say about that, sir, is if the federal government, if the state government, if the county government implement a mask mandate, that's up to them. So it can't guarantee that there won't be one. So just keep that in mind.
They can mandate whatever they want. They can't. We will not comply.
I make it, I'm,
Say it because you guys weren't going to say it, but
Mr.
you can mandate anything you want.
Mr. Chair,
Right.
Mr. Chair, I make a motion that we adjourn the meeting.
Second.
I just wanted to say one last thing.
Sir, we can have some discussion afterwards if you don't mind, please. Okay, so got a motion to adjourn the meeting and a second?
Yes.
Okay, everyone in favor, say aye.
Aye.
Anyone opposed? Okay, the meeting's officially